Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 17 Homeopathic Remedies for Tonsillitis. What are tonsils? Within our mouth cavity at the base of the tongue, there are a type of lymphoid tissues arranged all around the inner throat but are not visible generally. When they are infected, many of them swell up. Then we can see them as rosy red swollen tonsils on both sides of the throat. Now, just check the picture. This is natural tonsil. Tonsils are not visible here. Now, here note that the tonsils are visible because now they are infected, they have swollen, they are red, so these are easily visible. What are types of tonsils? Truly, they are mainly of three types. Palatine tonsils lie on both sides of throats. Please simultaneously look at the picture. Palatine tonsils, these two palatine tonsils. Here, it is here. Number two, pharyngeal tonsils lie at the back of the throat. These are also called adenoids. These are adenoids. This one, adenoids. And last one is lingual tonsil, lies at the base of the tongue. At the base of the tongue, look this thing. This is tongue, base of the tongue. This is tongue, this is base of the tongue. Generally, palatine tonsils, that is first one. This first one, palatine. Generally, palatine tonsils are infected mostly and swell up to catch our attention. So, these are called tonsils ordinarily. So, ordinarily tonsil means this palatine tonsils. What is the role of tonsils in our body? Tonsils are made up of lymphoid tissue which are part of lymphatic system of our body. This system is again a part of immune system of our body which guards our body day and night to protect from the damaging effects of different types of microbes as well as foreign bodies. Throat is the entry point of our digestive system and respiratory system. Lymphoid tissue situated there are the first layer of guards in our body. They catch the dangerous substances lying in the foods, drinks, as also here, as also in the respiratory air. To fight against this toxin, they produce more tissue. They means the tonsils produce more tissue, so they swell up. Now on the right hand side, please look at this lymphoid system. The lymphoid system, all parts are shown here. Note from the top, adenoids, tonsils. From the starting, adenoid, tonsils. These two are part of this lymphatic system. How to manage the problem of repeated attack of tonsillitis? Each of us acquires disease dyscrasia from families of our both parents, of which some remain active, some dormant. Thereafter, to it are added environmental effects of person's own habits, lifestyle, addictions, etc. Thus, a person's own constitution is formed. Again, with time, this constitution changes, but a portion of it remains almost unchangeable. Going through every aspect of life of the person suffering from repeated attack of tonsillitis, we have to find out what is the trouble with him. If the problem lies with his personal life, then it is easy to rectify. For example, if he lacks nutrition, the same may be compensated. Else, if his addiction is the reason, he may be persuaded to stop it, etc. However, if the reason lies in his constitution inherited from the parents, the same may be challenging to tackle with, but not impossible. Any system of treatment aiming to correct the constitution, aiming to treat the correction of the constitution of the person, constitution of a person can manage such a situation if the physician is sufficiently serious, diligent. Homeopathy, tissue salt therapy are quite competent to fight this situation. Now we are going into the remedies details. At the very onset, a rule of thumb of potency selection, dose, repetition, administration of remedy. For acute cases, selected remedy 6, potency 6, 3 to 4 globules, number 20 to 30, 2 hourly to be given on tongue for sucking. Or selected remedy 30, 3 to 4 globules, number 20, 30, For early to be given on tongue for sucking. If the remedy selection is perfect, cure comes within 2-3 days. For chronic diseases, select remedy 2000 or upwards. 3 to 4 globules, number 20 to 30. 2 doses, 1 dose in empty stomach in 2 consecutive mornings. Wait and watch for minimum 1 week. Second prescription may be repetition of the first, the higher potency, or maybe a new remedy start afresh. Action is dependent on the principle of doctors Kent's 12 observation. Chronic diseases are very difficult to manage. So one must know many other things that are needed generally for acute cases. So you must know the doctor's Kent's 12 observation beforehand if you really try to fight chronic cases. Number one, Baryta carb for tonsillitis. Whenever patient catches cold or feet, sweat get suppressed, tonsils get swollen with pus, especially on the right hand side. Trouble felt on empty swallowing, as if a thorn is stuck in the throat. Patient feels exhausted. Chronic induration of tonsils. Induration means hardening. Trouble much felt during eating solids. Muscles of throat partially paralyzed. Glands about neck, jaw, back of ear swollen, may be tender or not. Scrofulosis. That is this symptom collectively is called scrofulosis. This is a picture that right sided of the tonsils enlarged. Number two, Baryta mure for tonsillitis. Tonsils enlarged tend to get pulsy and or gangrenous. Children move about with open mouth, talk in nasal tone, suffer from hard of hearing, look like idiot. Water-filled vesicles in mouth, smell of mercury in mouth, profuse salivation, uvula large and reddish. Inflammation spreads from epiglottis, glottis and further down. Tonsillitis every time they catch cold. Belladonna. Number three, belladonna for tonsillitis. Right-sided tonsil swollen, bright red. Worse when swallowing fluid. During swallowing sensation as if throat very much constricted. Nothing could pass through. Tonsil full of many small ulcers. Whole throat looks intense red. Pulsation in carotid artery. Pulsation in carotid artery beside throat clearly visible. You can watch this battery is pulsating. Neck region swollen, pain felt during touch and movement of neck. Number 4, Mark Bean iod. For tonsillitis, throat, gum, tongue swollen. Difficult in swallowing all foods and drinks. Halitosis. Halitosis means bad breath from mouth. Profuse sweat, lymph glands around neck, throat hard. Inside of throat look purplish black. Trouble more on the left side. While drawing air through nose powerfully, greenish solid mucus comes out of posterior nare and pharynx. Ulcer on swollen tonsils. Posterior nare means the back portion of nasal opening in the throat. Number 5, mark proto-iod for tonsillitis. Same sign symptoms as above with the following changes. Worse from empty swallowing and warnings, trouble more on the right side. Vaccination for tonsillitis. If there is a history of tuberculosis in the family or tonsillitis reappears repeatedly, or when well-selected remedy fails to give desired result, or if routine blood test of subject shows high eosinophil count, then this remedy may be strongly indicated. Number 7, for sulfur for tonsillitis. Tonsillitis recurs again and again. Remedy gives temporary result. Subjects like sweet, either suffer from skin disease or have history of skin disease, get angry easily, cannot keep standing, look for seat, like to be keep bare-bodied. Number 8. Lycopodium tonsillitis. Right-sided tonsil more affected, more red, more swollen, and affection moves from right to left. Throat dry, yet no thrust. Likes warm drinks, but not cold ones. Sometimes swallowed food and drinks come through nose, that is come out. It is some sort of vomiting back. 9. Calcarea carb for tonsillitis. Palate, uvula, tonsils are inflamed and swollen. While swallowing, sensation as if throat constricted. Pain moves from throat to ears. White or yellow ulcers on tonsils. Number 10. Calcarea iod for tonsillitis. Inflammation of larynx and with chronic tonsillitis. Difficulty in talking. Tonsils are full of small tubules and holes. Number 11. Calcarea fust for tonsillitis. Chronic tonsillitis with otitis media. Empty swallowing is more painful compared to swallowing of food and drinks. Troubles felt more when thinking of the disease. Subjects are habituated to expire deeply and voluntarily. The related damage may kindly be noted. 12. Hippersal for tonsillitis. Hard of hearing with chronic tonsillitis. While swallowing, sensation as if a thorn pricked in the throat. Subjects can tolerate slight cold wind, always in state of hyper. That is, the patient are in hypersensitive state. Number 13. Calibicrom for tonsillitis. Inflammation of uvula pharynx. Yellow coating on tongue. Foul odor in the mouth. This is yellow coating on the tongue. Saliva appears to be stretched like a rope from mouth. These characteristic symptoms of, not characteristic, maybe called guiding symptoms of calibicromicum. The saliva appears to be stretched like a rope from mouth. Pain moves from ear to throat. 14. Syphilinum for tonsillitis. Chronic tonsillitis of hereditary syphilitics. Number 15. Phytolacca for tonsillitis. Uvula, tonsil, both are swollen, bluish, ulcerated with burning pain. Fever with chill, trouble in drinking warm water. Pain at the root of tongue. During swallowing, pain moves from throat to ear. Grayish white thick coating on tongue. Body extremely tired. Follicular pharyngitis. 16. Shorinam for tonsillitis. Right-sided chronic tonsillitis, burning in throat as if it is really burning. Submaxillary gland swollen. Note the submaxillary gland. Submaxillary gland, this is submaxillary gland. There are three sets of salivary glands. Parotid, sublingual, submaxillary. Bad breath, pain, even if sputum is swallowed. Best selected remedy fails. Patient of strong sodic diathesis. Number 17. Sclerotia for tonsillitis. Tonsil swollen, deep ulcer on tonsil, gangrenous tonsil. While swallowing, face appear to twist weirdly. That is, patient twist his face weirdly. Pus secreting gland shows no sign of respite. Worse on left side. Sensation as if a thorn was pricked in throat, which excites cough. With this, the video ends. Thanks for listening and viewing. If any problem is faced, please write down in the comment section. I will certainly respond.